bit on deforestation, which is very interesting and not so easy for most of us to link to heart ailments. Apart from pollution, are there any other links between deforestation to heart ailments? Thank you.
One of the easiest thing is I left India 40 years ago, and at that time I remember 42 degrees centigrade was the highest temperature recorded in India in Allahabad. At that time, it was a big news. I'm talking about 1982 when I left India. And today, most cities are recording 50 plus. That is a direct effect of deforestation. That's the biggest, the environmental change that is occurring around us. The deforestation because of urbanization, industrialization, and highways that you're creating. This concrete jungle that you're creating, that is the cause of these temperature rise. With these temperature rise, then it goes far beyond the forest and far beyond the earth. It goes in the ocean, the flora, fauna, everything around us is changing. So this is all linked. Now, this is not new. For example, we talk about pollution in Delhi. Those of you who wear these London fog clothes, right? Where did the word London fog come from? In the 50s, the whole London was foggy. Why? Because of industrialization and pollution. London got cleared up. And then those of you who live in the US might remember in the 60s, Los Angeles was unlivable. And now it's a beautiful, clean city. It was all industrialization, deforestation, pollution. Same thing, those of you who remember 2013 or 12 Beijing Olympics. Beijing was unlivable. And now Delhi is unlivable. So, for example, there's a study that came out of Delhi. If you live in New Delhi, it's equivalent to smoking 46 cigarettes a day. That is the extent of pollution there. So all this is a direct effect of these four things: industrialization, deforestation, transportation, contributing to pollution, and there's a huge effect on our health. And along with that, everything else that I told you in Dash. So we need to look at all these 10 lifestyle factors and how we can optimize. To me, lifestyle, it's a lifestyle disease. Heart disease begins in mind and in the mouth.
Thank you. Thank you very much, Dr. Susheel. Much appreciated. We have Dr. Satish Babu, who has just joined us. Thank you very much, Doctor, for joining us today. Dr. Satish Babu is eminent in the Sri Sathya Sai Institute of Medical Research. So thank you for making time this morning to join us. Perhaps you could help add to the question that we've just been discussing. What, in your opinion, is the reason why there seems to be an increased incidence of heart-related ailment and heart attack in young adults recently? Thank you.
Good morning, and thank you. My apologies. I'd held up with a meeting in the backstage with Somi. So we as a medical students, and in last 30, 40 years, medicine has evolved a lot, and even probably our problems, our diseases are also evolving to the change of what human race or the evolution is going through, is what I would say philosophically. So when we studied, there were traditional risk factors for cardiac diseases. So, which from yesterday we are listening: hypertension, sugar, salt, your genetic framework, and smoking. So these are genetic framework is probably non-modifiable, although epigenetics is a evolutionary change which is happening to the current lifestyle what we are leading. But what I meant from genetic make is Asians are prone. Again, there are a lot of research into fetal programming. We are always evolved for last 2,000 years from being famine, drought, to very lean time being abundant with food. So the body also evolved for that. We had less of stored fat to take care, and as soon as there was food abundance, this fat mass in the body started playing around, and your insulin resistance, cholesterol, these things added to the problem. So these are traditional risk factors. sugar, salt, cholesterol, hypertension, uh, uh, genetic framework, and smoking. The modern problems, or modern probably for last 15 years, 20 years, what are the risk factors again, or the contributing factors added to this are, again, you can say stress, your lack of sleep, screen time, both mobile and in front of TV. So, and probably you can again say, as Sadhguru mentioned, lack of being, having a serene mind, which probably equates to or translates to being bit spiritual. So when you have somebody to look for, or you have a higher force, higher power to sort of solace yourself, your stress levels comes down. So these things are added in probably in last 25 years. And of course, the major modern, which is so probably equated to smoking, almost smoking as big risk as smoking, is sedentary lifestyle. All our jobs in last 20, 30 years have moved to being at least a little physically active to sedentary lifestyle. Our desk jobs, our leisure activities are more, and physical active jobs are less. So put together these traditional plus modern risk factors are the, and why young? It starts very early. You don't have playgrounds. You don't allow children to play. As soon as they come back from school, you have back-to-back tuitions. You have mobiles. You have TVs to sit and watch. What we call as couch potatoes, and on top of it, you are feeding them very calorie-dense, processed foods with physiological levels of salt, sugar loaded in this calorie-dense processed foods. So the disease process is starting very early, and the disease progression is shortened, and aggressiveness is shortened. So at 30, 40 years, you are seeing heart attacks.
So
Sorry, it was a long answer.
Sorry, just a quick question, doctor. So would you say what you've just described to us applies to pretty much all ailments, all chronic illnesses? The
Yeah.
onslaught of it starting
Yeah,
earlier.
they all have a sort of common pathophysiology, almost. You can say what they put it as metabolic syndrome, your cholesterol, your BP, sugar, central obesity, polycystic ovaries, hyperuricemia, homocystinuria. All this are confluence of problems, with the common source being adiposity, insulin resistance, sedentary lifestyle, and a bit of genetic framework or epigenetics playing into.
Thank you, Dr. Babu. I know you're an endocrinologist, so I'll come back to you on insulin resistance shortly. But before that, let me move to Dr. Shuba. Dr. Shuba, I'd like to ask this question. What are some of the biggest misconceptions today relating to heart health? So what do you think we should know, which we don't know, or what we think we know, which we wrongly know? Could you please guide us on that? Thank you very much.
Thank you, Sheila, for that very nice question. Because we are faced with this on a daily basis from our patients. When we talk to our patients, we realize the kind of misconceptions they are born and bred with. And I think these misconceptions or these myths with regards to healthcare, which is across all kinds of health, not just heart disease, but every other kind of chronic ailment, I think this also differs from rural to urban, and from young to old. So each of them have their own misconceptions. The urban, probably because they are a little more aware they're more knowledgeable, they're a little more educated. So their misconceptions would be different from the rural population because of their lack of awareness, lack of education and all. But I think something that is common across the board is many people seem to think that heart disease or coronary artery disease is something that happens to older people, does not happen to young people, though of course we are seeing evidence to the contrary in the recent times. And like I said, in the urban population, probably this awareness is more because they see this, they talk about this, but I think slowly it's trickling down into the rural population as well because of television, social media, and other things. But this is one common misconception, and especially young people seem to think that they're sort of protected from this, and it's more a disease of the elderly. And the other, which is a dangerous misconception, is the fact that many people think that it's only the obese people who are likely to develop coronary artery disease, which is also a misconception because, in fact, Swami mentioned this in his talk today, what Indians, we are the lean fat. We look very lean on the outside, but we have a lot of fat that is stored in the body. So what people don't understand is fat is of two types. There's fat that is in the subcutaneous tissue. That is what we see when we say somebody is obese, somebody is fat. This is the subcutaneous fat that we are seeing. And that is not the bad fat, actually. So the other fat is the fat that covers all our organs, and we call this the visceral fat. And this visceral obesity is what is more important or more dangerous and more likely to cause heart diseases. And this, especially amongst us Indians, though we may look lean on the outside, we have a lot of visceral adiposity, and this predisposes us more to heart attacks. So this is also something that people should become more and more aware of. Just thinking that going on fat diets and losing body fat, that is what you're losing is the subcutaneous fat. So if they're not adopting healthy lifestyles, healthy eating habits, exercise, all these things which should actually reduce the visceral adiposity as well. If these things are not catered to and we're only focusing on the subcutaneous fat or the, the optics as we call it, that you just want to look slim, but you're not actually slim inside. So this is a very major misconception which I think, people should slowly start thinking about this and coming out of this misconception. Amongst the rural population, they have certain misconceptions, especially when it comes to taking medications. Suppose we put them on cholesterol-lowering medications. We tell them, okay, this is good for you. So they seem to think, we hear this from patients all the time, that once you start medications, you're going to be addicted to it. It's an addiction you can never come out of. So they don't realize that these are preventive measures, which can be temporary, not necessarily permanent. If they change their lifestyle, they change their habits, they might not have to be on these medications forever. But they seem to think that, starting medications is not a good thing. And they're very prone to listening to their neighbors, their people who, their area of influence is very vast. And they're not influenced by doctors, unfortunately, or healthcare workers who, want to give them the right advice. They're very much influenced by the people in their community. And they like people who kind of give them the advice that they're looking for, So medications are not good for you. So this is another misconception which on a day-to-day basis we try to fight, we try to educate patients. And of course, dietary misconceptions are there because we here in rural Karnataka, especially what we see is we see them eat a lot of ragi, which is very good, but that cannot be the only thing that they should consume, that they have to consume lots of fruits and vegetables and all of this. So this is another thing that, that needs to, we need to kind of make them aware of and educate them. So these misconceptions and myths kind of change with the kind of population that we are looking at as well.
Thank you, Dr. Shuba. Just one quick question. You've mentioned that there is the real culprit is visceral fat, not subcutaneous fat. Thank you. I think most of us have in recent years heard a lot about visceral fat. But is that something, as a general practitioner, we can avoid, or is it a genetic predisposition for Indians?
Yes, so in Indians, unfortunately, yes, it is a genetic disposition that we are more predisposed to having visceral fat. But nothing is totally unavoidable. I think like one of the speakers in the morning was talking about the fatty streak or the atherosclerotic streak actually starts in childhood. So if we start inculcating good habits into our children from childhood, so this is something then we can slowly avoid. Because once it comes on, it becomes very difficult to get rid of. But preventing this from happening is the key to preventing early coronary artery disease.
Thank you. Thank you, Dr. Shuba. I'll move on to Dr. Deepak, please. Dr. Deepak, what are the early warning signs of heart disease that people should never ignore?
Yeah, all through my presentation, I was told that what are the early signs of heart disease. But apart from the classical that we heard, the patient having some chest discomfort while walking or some breathing difficulty while walking, these are the patients definitely needs evaluation, whether they have underlying coronary disease or not. But some people, what they do is a bit of uneasiness, a bit of, okay, I'm not feeling well. These are the few symptoms that is very common. And these people are definitely maybe harboring coronary artery disease, and this uneasiness is a part of their recent increase in blockages. So they needs to be evaluated. So any symptoms which is not natural for him, suppose someone had a fatty food or a spicy food and suddenly have burpings, satiety, we understand that. But out of context, someone is having something uneasiness which is out of proportional to his regular activities, definitely these are the people who should seek attention, go to the hospital, get at least an ECG done, and then see. Many times it may not be a cardiac event, but at least you have ruled it a cardiac event. There is no reason that we should not go to the hospital, or you should look like a fool that for a small disease you have come to the hospital. Whenever there is a doubt, life is very precious, so whenever there is a doubt, please go to the hospital, get yourself checked, and maybe your symptoms are due to coronary artery disease, we don't know.
Thank you. Thank you, Dr. Deepak. Thank you, Dr. Karthik Ramesh, for joining us. I understand that you have a keen interest in the role of technology in advancing medicine, in preventive medicine, and in curative medicine. So thank you. I will direct my questions to you soon. One quick question for Dr. Susheel. Dr. Shuba mentioned visceral fat. And I asked the question, is there anything we can do to minimize or avoid accumulation of visceral fat? Because most of us who think we're slim think we're healthy, and that's a misconception, and that's an illusion if we have a lot of visceral fat in our organs. So anything from natural therapy, I understand natural remedies like garlic, ginger, turmeric, moringa have all been bandied as great, superfoods. Anything you can suggest to us that helps increase heart health, reduce predisposition to heart ailments, and just increase general overall reduction in inflammation in the organs? Thank you.
Yeah, thank you very much. Thank you for the question. So both Dr. Satish and Dr. Shuba alluded to truncal obesity or visceral fat. So we call it, when I left India, there was no tofu here. So I think tofu is acquired, the thin outside, fat inside. And even ACC actually had a review last year on that. It's called ABCD, adiposity-borne cardiometabolic disorders. So they came up with ABCD, DBCD. I'll discuss some of that tomorrow. And DBCD, I think you'll be addressing dysglycemia-based disorders. These are acquired diseases. So first of all, let me tell you a very simple test. If you need to know whether you have visceral obesity or not, I tell you a very simple, priceless test, okay? It costs $0. In the morning, when you take your shower, get in your underwear, and stand in front of your mirror sideways. If your belly button is in front of your chest, you have truncal obesity. If you have truncal obesity, by definition, you have visceral obesity. So you have to try to understand the difference, as Dr. Shuba was saying. Subcutaneous fat, which is fat outside, is inert fat mostly. But the visceral fat that surrounds the organelle, right, for example, pancreas, liver, and inside, that is very active fat. In fact, the largest endocrine, paracrine, and exocrine organ in the body is not your pituitary or your thyroid, as was taught to us in medicine 20 years ago. It's actually the truncal fat. It secretes hundreds of hormones, hundreds of inflammatory chemicals, IL-1, IL-6, TNF-alpha, to mention a few. So this is really a factory of atherogenesis. And this is exactly the reason why in Indians, when I left India 40 years ago, there was no truncal obesity. This is new, so this is acquired, lifestyle born. And these have led to a very different metabolic syndrome in India. So one is that LDL is not the sole culprit of blockages in India. We have this atherogenic dyslipidemia, as Dr. Satish was saying, a very peculiar lipid disorder of Indians, high triglycerides, low HDL, and small dense LDL, typically Indian. Then we have lipoprotein little a deficiency, elevation, which is 20% Indian. So if one takeaway you can take from this talk today is please everybody get your lipoprotein little a tested, okay? This is huge. 20% Indians have it. It's 5 to 10 times more atherogenic than LDL that you're treating. It's also clotogenic, thrombotic, and it's also pro-inflammatory. And then there is metabolic syndrome that was talked about. So all these things come from this truncal obesity, visceral fat. I keep coming back to that. The only way to get rid of truncal obesity or truncal fat, all these things, is to change your lifestyle, which again is diet, activity, stress, sleep, social, spiritual, and habits. And how do you do that? You do that by transforming your mind. So the alternative therapy that we're going to talk about, which to me is not alternative, which is mainstream. If you do my program, yoga is mandatory. If you're not doing yoga, meditation, pranayama, I ask people to quit my program. Because there's only one tool that can compel you or impel you or inspire you to change your lifestyle, and that is mind transformation. And there's only one technique of mind transformation. It's only in the East. There's no Western mind transformation technique, and that's yoga, meditation, and pranayama, 3 things.
Thank you, Dr. Susheel. Sorry to cut you short there. I'd like to move on to Dr. Satish Babu, please. Dr. Satish, thank you very much for that very enlightening explanation of visceral fat and how we can avoid it. Thank you. So, doctor, I'd like to move on to hormonal imbalances, right? I understand that hormonal imbalances such as thyroid disorder, insulin resistance, etc., have a direct bearing on heart health and the incidence of heart ailments. Could you please elaborate on that? Thank you.
Yeah. See, I'll take up thyroid because it's not a big problem, but insulin resistance is more of a big problem. I'll take up thyroid first because it's second most hormone dysfunction, and most of you all know about thyroid. So there are a lot of misconceptions again in thyroid. So hypothyroidism, where you make less hormone of thyroxine, is strongly linked to these problems, what we are discussing today, coronary artery disease, through in fact, the cholesterol only, through dyslipidemia only. And of course, there is other effects on the myocardium itself, on the heart muscle itself. So it can lead to sort of heart failure and those things, but that is separate. But hypothyroid, as I said, can be linked to coronary artery disease, whereas hyperthyroid is more of a electrical, that is impulse issues can happen. Most commonly atrial fibrillation, which is heart beating fast, the upper chambers, atrium beating fast. So those are the general or common heart ailments linked to thyroid. But more importantly, insulin resistance. Insulin resistance, visceral adiposity, central adiposity are interlinked, and that's the mother of all problems. So all the gist, as sir said, the take-home message is central adiposity, that leading to insulin resistance, that leading to cascade of multiple effects happening in the body, starting from low good cholesterol, HDL, high bad cholesterol, both triglycerides, LDL, ApoA, all this trigger happening. And of course, your glucose comes into picture, your hyperglycemia comes into picture, and insulin resistance is a sodium retainer. So it retains sodium and makes your blood pressure more, and insulin as such is a sodium retainer. So it conserves sodium in the body. And put together, again, there are endothelium, means to say blood vessel, functional dysfunction happening, means normal functioning, that relaxation, contractility, the compliance of the blood vessel, which it should be elastic, that changes with sodium shift. And all put together, I again come back, central adiposity, insulin resistance, lot of low-grade inflammatory changes happening, causes over a time, within say 5 years, 10 years, the atherogenic or ischemic heart disease, coronary artery disease.
Thank you, Dr. Babu. Thank you so much. I would like Dr. Karthik to please enlighten us on this one interesting question, at least for now. But before I ask you the question, I'd like to prep our audience. We're going to open questions for audience, and we have a very short window because of time constraints. I request you, I hope you have mics, but if not, can the IT team please ensure there are at least 1 or 2 mics down there for the audience. Please think of your question. We'll come back to you in a few minutes. Doctor, can I ask you this question? How do you have a mic? Oh, sorry.
Thank you.
Is it working? Okay,
Yeah,
great, sorry. Okay, how do you see AI reshaping cardiovascular disease prevention? First question. Second part, do you see AI helping with effective treatment of cardiovascular diseases going forward? Thank you.
Yeah, so Harvard Business School said that AI is not artificial, but it is authentic intelligence. So among authentic doctors here, I'm the only AI person, so I hope I can give an authentic answer to that. I had the privilege of being temporarily the CEO of the Indian Association of Cardiothoracic Surgeons 2.5 years back for a period of a year. And that gave me great insights on how application of AI can be used. We've heard it in the morning from the legends like Dr. K.R. Balakrishnan, who's developing at the forefront AI-enabled devices. And we also see that AI is more pervasive actually than heart attacks. Everywhere AI is there. So if I look at artificial intelligence from a preventive aspect, the most common thing we do when somebody has symptoms of heart attack is we go and take an ECG. Today, many of the ECG machines without AI can give, based on the signal, some insights. But the applicability or the uniqueness of artificial intelligence comes when you can program these outputs through an algorithm which can, without a doctor, give suggestive recommendations of where the problem can be. And if I extend that example of ECG, which is more of the waveform of the electric impulses of our body, if I extend it to imaging, today, before anybody gets treated for coronary heart disease, you take echocardiograms, you do various types of scans. Artificial intelligence using deep learning and image processing today, there are several algorithms which can again pinpoint the exact nature of the problem. But I would still add, having trained actually over the last 3 years, I attend a lot of scientific conferences talking about AI and cardiothoracic vascular as a subject. And surgeons don't like me because they always tell me that AI is never going to replace the healing hand or the healing heart of a patient or the healing hand of a doctor. And I completely agree to that. The other thing, there are certain scores such as CAD, DAD, which University of Australia has developed, which gives the prediction or the risk assessment score based on various parameters. We are working today in the UAE where I live and also with many of the leading institutes here of how you can look at socioeconomic parameters, demographics, you can look at physiological parameters over past maybe tens or hundreds of thousands of data points. What kind of symptoms did the patient come with? What kind of treatment was given to them? What was the efficacy of that treatment? How useful was the treatment? Now this, as Steve Jobs said, you connect the dots looking backwards, not forwards. When you look at the backward trends, artificial intelligence still just becomes a tool or an enabler. Today we develop, I work very closely with Dr. K.R. Balakrishnan on many projects, including, we were having a conversation after his talk of, we could go for conversational AI-based tools. Today, a patient can look at a simple mobile app, feed in their symptoms, just talk about their symptoms, or even take photographs of how, their retina is. AI today can detect problems. So the scope and applicability of AI is huge, but I'll just conclude again by saying that not only that it should be authentic, but it should be augmented with the expertise of a cardiothoracic vascular surgeon for AI to be effective in preventing heart attacks.
Yeah,
Thank you.
I think that's definitely true for all professions. It will definitely change the dynamics as a tool, but it can't replace an expert
Absolutely.
that has kind of worked their way up to give that added personal touch. Thank you
Agree.
so much.
Thank you.
Cheers. I'd like to pause now for any questions from the audience. Anyone would like to pose any questions to our panelists? Yes, sir, with the dark gray shirt. Yes, sir, you in front. Yes, please.
Yeah,
Would
so,
you-
yeah, mic is with me. I'll just finish it in 2
okay,
minutes.
sure.
My name is Prasad. I'm a farmer from nearby place called Andhra Pradesh. I had a interaction with a few doctors and few patients who consumed millets and garlic, as you said, ginger and vinegar, and got their blocks will disappear in 6 months. Is it true? Has there been anything recorded, and in how many patients? Whether soluble fibers are really there in our traditional foods
So
which
I
can
think
cure
keep
it?
it to one question,
Yes,
please.
that's all.
So
Thank you.
I think your question should be directed to Dr. Susheel.
Yes,
He's
thank you.
identified some natural remedies, and the question is, are they really effective? Has there been any evidence to suggest they are in curing or helping, right? Thank you.
So this is a new fad. A lot of millets are coming into vogue. I think the reason why millet is better than the rice and the wheat that you're eating is this. Millet is a very, very small grain, so you cannot process it. You cannot unbran it. Really, the phytochemicals and the fibers of the grain are in the bran and also in the germ. And when you mill a grain...
Sorry, Dr. Susheel. Just please help because of time constraint. Do they actually cure?
Well,
we don't need the physiology.
there is no published scientific evidence of double-blind trial of any of these things. So these are anecdotes. So I respect and I concur with your emotions, but I have not come across any scientific data saying that millets can cure blockage in 6 months.
Thank you. Perhaps there should be some research done on that point, and maybe we'll find some answers when we have the next conference or the next few conferences. Thank you. Any other questions? Sir, you wanted to ask one question? Yes. Can you pass?
My name is...
Yeah. Thank you.
It's a very related questions that people
Please
are
keep
switching,
it brief. Thank you.
switching over to the new food diet, and there are many suggestions. My question is, any sudden change in the food habits that we've been eating for generation, is it good for the health? Because myself have seen many people after going through a change in their diet, they're not well anymore.
Yeah,
But
sorry,
I wanted
we didn't hear the last part. Change in the diet? Sudden?
Change in the sudden diet, and at least after the age of 40, 45.
Okay. Dr. Shuba, would you like to answer that question?
If I understood you right, I think your question was, if you change your diet from what you've been traditionally eating all these years, isn't it? Yeah. So that's a very good question. Actually, again, that would probably be Dr. Susheel's domain. But the one thing that I would like to add is this has been spoken about by several nutritionists. If we had a nutritionist amongst our midst, I think they would have been able to give you a better answer to this. But lots of nutritionists who have studied diets over decades have made this point that you must always eat local, and you must eat what is your grandparents have traditionally eaten. And this is actually the best advice anybody can give you about diet. Now, what has changed is, of course, like Dr. Susheel was saying about why millets are good, but what has happened with rice and especially with paddy and wheat is a lot of genetic engineering that has been done into the crop, because of which, it has become a little detrimental. But I think the wheat that was consumed before was much better than the wheat that we're consuming now. So that way, millets are ancient. They're the kind of diet which people had, even like our grandparents, great-grandparents had that. But what changes is that the quantity that we consume. I think a lot of problem is not with what we are eating many a times. It's also the quantity and the proportion in which we are eating. Yeah.
And I think I just add pesticides and preservatives have probably contributed dramatically to the decline in the quality of our food. Also, I understand quality of the soil. Soil quality has deteriorated over time as well, which means less nutrients in our food. Probably all that have added to the problem we face. Any questions from the women? Thank you, sir. Any questions from the women? Yes, please.
Yeah. With rising cases of heart disease among youth due to lifestyle and stress, what are the most effective early intervention strategies that schools, colleges, our parents and healthcare providers can adopt to build a heart healthy generation?
Okay, early strategies to adopt from school-going age. Anyone would like to? Dr. Deepak, would you like to? Thank you.
Everyone will have their own answers. My thing is exercise, exercise, and more exercise.
Yes. Anyone else would like to add to that?
School children, games, games, games.
So it's exercise, exercise, location, location, location. So heart health is exercise, exercise, exercise. I think we've come, thank you very much, due to the time allocated to us. Thank you to all our esteemed panelists. You've really enlightened us. We've got a much better insight on what to do and what to avoid. I'd just like to end and thank you to our guests, delegates, for your interesting questions. Perhaps a quick summary of what we should do would be this in my takeaway. God, grant me the serenity to accept things I cannot change, i.e. genetics, climate, where I live, what grows in my country as food. Grant me the courage to change the things that I can. Early to bed, early to rise, more exercise, better food, more discipline, better habits, avoid too much technology, mobile phones, and other electronic impingement into our physiology. And please grant me the wisdom to know the difference. Thank you very much, and we hope to see you again next year. Sai Ram. God bless.
Thank you, panelists, for your insights and that very engaging discussions. Your practical advice and suggestions are great takeaways for all our delegates and participants. We would like to extend a token of our appreciation to our panelists, to Dr. Susheel Sharma ji, to Dr. Deepak Saha, Dr. Karthik Ramesh, Ms. Sheila Awat, Dr. Shuba Srinivasan, and last but not the least, Dr. Satish Babu. I request all the panelists to please come forward for a group photograph, please. A group picture, please. Thank you. We will now move on to the next talk. It is said, Yad annam tad manaha, as is the food, so is the mind, because we are what we eat. Food just does not shape our body, but also our mind and spirit. When consumed, food becomes a sacred offering and supports our inner journey towards balance and well-being. We now have Dr. Devji Patil, who will be taking us through the segment of healthy eating. Dr. Patil is a public health expert with over a decade of experience in nutrition and maternal child health. He currently serves as a consultant with IIT Bombay and Sri Madhusudan Sai Institute of Medical Sciences and Research, contributing to evidence-based health initiatives. Dr. Patil, please.
Good morning. What did you eat in the morning? Lot of noise here, no noise here. Did you like it? Was it good? Was it good? Ah, very good. So, this simple question, we don't ask, what did you eat? For example, if you are a doctor, if you are a medical doctor, and if you are training, none of your professors will ask you, What did you eat today? And when we look at so many things which were discussed in the last session about stress, about so many problems that are affecting young hearts, one of the things is that there's a collective loss of memories, ancient memories. How did we eat? How did we live? What food we liked? And millets appear to be suddenly, there has to be a campaign for millets. So while, I am a lifelong health practitioner, you can say. I'm a medical doctor basically, and over the last 4 or 5 years, as a part of my own journey of remission of diabetes, I've entered into a territory which I absolutely love. So here in the next 20 minutes, I'll try to articulate what are the thoughts that are there in my mind. Not necessarily a prescription, because as the number of people, so many number of kitchens. So many number of kitchens, so many number of measurements. Even if you make tadka also is not same in 2 houses in India. We talk about diversity every 25 kilometers of language, of culture and things like that. But extremely diverse food habits we are having. And what has been my journey of how to understand what is eating right? The statement that I've eaten millets, I have changed blocks, I have fasted, I have melted my blocks. Now these are no longer anecdotal. I'm hearing more and more people talking about it. And so is the fact that if there is a change from rice to millet, will you be able to sustain that change? So these are the interesting things. So it will be good to have a conversation. So think that it's a conversation, it's not a lecture. We all know this, rise in diabetes. Everybody knows it. In every single workshop, in this hall, if I ask you, how many of you are diabetic, or how many of you in your family has diabetes or hypertension? If I expand it to the array of things that are caused due to insulin resistance, it can be even more higher. There's practically nothing. We are looking at an obesity pandemic in children. Huge rates in 5 to 9 years as well as 10 to 19 years. This is the 10 to 19 years is very much in the cusp of the young age group. We are looking at huge diabetic load. Recently we did a survey. One district magistrate did a survey in one of the areas and checked fasting sugars and postprandial sugars in small age groups, because there was apparently a soda making factory in that area. She found that more than 30% of the children are pre-diabetic. So things are moving in a very different direction. Younger people now definitely, I don't know whether it is because of the news or because young people are really sick. I'm still not very clear about it. But definitely the eating habits in the younger children has significantly changed compared to the eating habits in adults. It mimics the eating habits in adults, but definitely not of our grandfather generation. 80% of Indians suffer from protein deficiency. Doctors have a grave misconception of, they do not know what is a high quality protein, what is DIAS, they will not know. And there is a huge gray area of proteins because many of them think that if I take proteins, If I take whey powder, I will have kidney problem. How much whey powder? Do you want to eat tons of it? Or, of course, everything good, everything in large quantities will be very bad. But there is a very thin line. What doctors are not understanding is that they are disengaged from the debate of nutrition. Reducing carbs slightly in diet can reverse diabetes. A highly contested area. Therapeutic carbohydrate restriction, highly contested. It's so contested that the people will get upset if I say you restrict your carbs. But gradually we are seeing that, yeah, there is a problem. Not only in the type of food what we are eating and the quantity, as how ma'am told in the last session. How to gain weight? Do you know? There was, in the 60s, there was an ad like this. How to gain weight? What did they do? Combining refined carbohydrates with vegetable seed oil, highly efficient in increasing body fat. So if you are skinny, this is the treatment which we offered. Which means what? Points to think. Refined carbohydrates and vegetable seed oils. Who will not have biscuits with chai? I'm absolutely in love with chai with biscuit. For nearly 30 years, from my time I went to medical college. Of course, I'm from North Karnataka. We are lovers of chai. We love tea. We love tea more than 6 times, 7 times a day. So we all have, one of the great family getting together is to have a cup of tea or coffee with some biscuits. One Parle-G packet. What will happen with one Parle-G packet? So food is not just about content, It's also about relationships. It's also about what time you get to spend in that cup of tea and so many other things. So food is not straightforward. Of course, these are from all the areas of India, various plates. Gujarati and Andhra and these are the buckets, bucket biryani. Young people absolutely are in love with bucket biryani. So we need to get to know what do they like, why do they eat, what are they eating, and how do they eat it. Slightly crowded slide, but the yellow and purple bars indicate the prevalence of high triglycerides, bad fat, bad cholesterol in children, both 5 to 9 years and 10 to 19 years. It's close to 30%. 30% of our young children are having demonstrable increase in their triglycerides, and they also demonstrate another thing called as low HDL. HDL is a good cholesterol. They are very low of it. Triglyceride is a storage form of cholesterol, considered to be bad. High, it is increased. So there is a ratio, what we talk about, triglyceride HDL ratio. What happened, I work with a very wonderful department here, of course with multiple departments, but Professor Anna Rao's department. Day for yesterday, in the department group, they shared one book. The book is 4,000 pages. And it's all about lab investigations. Remember, this is a preventive and social medicine department, now getting into lab investigations because there is a discussion in the department as to if you are preventing it, what are we preventing? How are we preventing it? So preventive sciences are increasing in their intensity and depth of engagement with chronic illnesses. And this is going to increase. And it's not going to stop. There is going to be more and more and more number of preventive and medicine social doctors who are going to come and talk to you about your own territories, like internal medicine, orthopedics, oncology, hepatobiliary sciences and things like that. Extraordinary high amount of waste increase in women in India. More than almost half of them have a waist circumference which is not healthy. Around 10 to 15% of men are like that, but I'm seeing men are also having abnormal waist circumference. What is the waist circumference? What are you going to do with the waist? Forget the body. Why are you worrying about the body? Some people say. But you know, it's so sensitive that if the waist circumference is above 34 inches in sedentary men and above 30 inches in sedentary women, it indicates metabolic abnormality that has set in. That means metabolic abnormality means whatever is you are eating is not working well for you. So paunch is not always good. Principles of eating are so varied. In fact, each one of you will have your own principles of eating. How to generalize this? So this is the topic I got, and I was cribbing about Anandji yesterday night. How can I talk about principles? Because in my practice of metabolic health, preventive practice of metabolic health, I see that everybody eats differently. Everybody needs are different. And everybody get information from multiple sources, multiple places, multiple people, all of them claiming to be credible. Planning your food, protein and protective food, it could be as simple as this. Lots of plants, adequate protein, minimally processed foods, limited saturated fats, sugars, added sugars, balance and variety. This is the Harvard recommendation. More or less, some commonality is in there in some recommendations. What is that commonality? Avoid saturated fats and sugars. Indians never avoided ghee, you know. There are two things in the last 30 years I have learned in nutrition sector. Indians never gave up on breastfeeding, which is also my core area of work. Indians also never gave up on ghee. Now the world is waking up to ghee, coconut oil and things like that and telling that you have to consume it. We always knew. We're smart people, you know. And really smart. I'm not sarcastic here. If there was no yoga, if there was no Ayurveda, we would have kind of, I don't know where we have. These sciences also bring in an internal capacity of Indians to question things, which is, I don't see it in the West, in the normal population. While if I talk about protein, carbohydrate, fats and minerals, vitamins, the common man will just walk away from the room. He's not there. He doesn't understand it. What he understands is something like this. Right mental state. They understand it in a very different way. Right quantity, right quality, right methods and place and right time. This is one of the sides of Ayurveda. I just took it because again I'm seeing that when Ayurveda you look at the eating right, Ayurveda is highly personalized. Sometimes I feel that Sankhya-based systems like yoga and Ayurveda are, I cannot interpret them in terms of modern science. They are distinct, separate ways of looking and arriving at truths. May it be the spirit, may it be the body. Now I am also looking at what Unani tells, you know. It also tells in the same understanding the functions, eating in moderation. So everybody says one of the key principles of yoga is that hit bhuk, mit bhuk. Fundamental principle. Eat little, eat fresh. More doctors smoke Camels than any other cigarettes. You know, there were one time there was an ad like this. So it means what? Who is giving such ads? The industry is giving such ads. So dependency on the West for evidence, industry-driven evidence, are big problem to common people. And when you look at young adults, where their problem is coming from, I have young adults who come to me. I said, so now I'm making a trend out of them. So what? Is there a placement for you? I asked them. Yes, sir. In 6 months, my job placement is coming. I have to look good. They will tell. Other is that there is a peer pressure. He or she is in a relationship already, and there are relationships, peer-related pressures that have accumulated. Slightly older men and women, they are getting married and they want to look good in their reception. There's also a continuous debate in India with respect to veg and non-veg. Veg is good, non-veg is good, and a lot of discussions. Personally as well as professionally, I don't consider this debate worthy to be debated in normal people. Yes, there are certain conditions in human beings where this comes into picture. Normalization of the high waist circumference. Very, very normal it has become. What do you want to lose? Do you want to lose fat or do you want to lose weight? If you ask this question, our people, our patients, they will say that, sir, I don't want to lose weight. I want to lose fat. I ask them why. Sir, weight is good, no, sir, if it comes from muscles and bones. This is a common man speaking. How does he know? Who has told him? It's always an intrigue for me. And of course, we eat according to what we taste. We are huge taste bud fellows wherein we are looking at taste as the single ingredient. In fact, Ayurveda, which is the basis of our cooking, normal kitchen cooking, the basis is also Ayurveda. Tadka is Ayurveda. And we have the flavors that come in and we need to talk about. We need to understand and we need to relish it. That's how we eat. Now, these are two iconographs. One is an image and another is both depicting Mahabali. See how we have changed. See the Mahabali in the first image, which is a statue, and see the Mahabali in the last. I have no problem with people being fat at all. But if you say that don't ask me, don't tell me whether fat people will not have problems, I have this lot of issues. Because this happened during COVID. They told that obesity and hypertension patients have a higher prevalence of COVID. I said, why? Why do obese people have this thing? So don't ask that question. You can't shame obesity, they said. I said, I'm not shaming. All my family is fat. They are all obese people. What I have to do? I'm a doctor. I have to treat them, no? So this is how obesity becomes normalized. Of course, Professor Satish Babu immensely in concise thing attributed to it. This is the bread and butter of my practice. That is insulin resistance. Just look at, these are all taken from various publications. Just look at the various manifestations. Insulin is secreted by pancreas, and pancreas is known as Agnashaya. In fact, they use this word Agnashaya in Madhya Pradesh during our training. So we don't know. As allopathy doctors, we have no clue about Agni. Zero clue about Agni. What Agni? Allopathy doctor, what Deepak? You go to that Ayurvedic doctor, they will say. Some of us are. No, there is a, I'm talking, when I take allopathy doctor, I'm talking about myself before 4 years. No clue. Just look at it, from skin diseases to schizophrenia, bipolarity. If insulin resistance can be reversed, can we reverse all these things? Yes. I am slowly having a very assorted accumulation of patients which are absolutely phenomenal progress. How much carb is more carb? Yesterday, a week ago, we had, me and Dr. Fanindra had gone for a workshop. It's a hydraulic division of Wipro. We talked with almost 100 of them, and we count their carbs, of course. And when we counted, they said average intake is 500 grams. None of them thought that it was abnormal. All of them had a protein count of high quality protein count less than 10% of what they require. In fact, if it is more than 254 grams, it is considered as very high carbohydrate because more calories come from carbohydrates. Now, let us set the principles of eating right. 1, eating is a choice. It is personal. It has got familial factors. It has got social, cultural, religious, and spiritual factors. Before we talk about any principles, or if we give anything to anybody, I do this mental checklist. Does he have a guru? Has he advised him anything? Does he have a religious consideration? Does he have a personal preference? And so on and so forth. Science is very dubious because science is truly not experimental or has not demonstrated to be itself to be experimental, especially with respect to nutrition. Because otherwise, we would have had a quick and robust reversal of Ansel Keys studies, which demonize saturated fats. This whole movement against such a ghee was not simple. Sometimes when I see how much India has tolerated, it's not a simple thing. And therefore, it's not a very easy thing to do. Several other principles. Understand metabolism as a central pillar, a final common pathway through which lifestyle diseases manifest. To me, the elephant in the room is IR, insulin resistance. We have to get real with young adults. Immensely stressful life they are leading. Very, very stressful lives. Sometimes I feel that students in this campus, I feel they are in heaven compared to other campuses. Sometimes I feel that, so many things are happening in this campus which I want, it's not there outside. Peer pressure, lack of meaningful interactions, and of course, ultra-processed foods. But when I look at ultra-processed foods, in the younger generation, ultra-processed food consumption is higher. But what is higher in the mid-segment adults is actually their counts are more. And I'm very touched by one young girl who happens to be my daughter also, who when I began my journey, 3 months later, she came and told me very quietly that, okay, now I think that you will live for some more time. Which means what? All the while, the girl has anxiety in her mind, saying that my father is not taking care of his or her own health. And when you become metabolically fit, there are metrics for it. When you become metabolically fit, then it will be easy for you to change the children. Young adults learn from older adults. Start young. Number 1, understand the difference between fast and feasting. Don't give up on the feasting, provided you fast well. No living grease leafy vegetables, colored vegetables, all kinds of things. The rainbow color should be on your plate every day. Particularly fermented millets, I think, are a total miracle and game changer. Particularly fermented millets. I don't prefer millets in actually any other form. Soaking millets is an issue, and also when you bring in millets, there are certain cooking changes what you have to do. Just before entering the hall, I met an elderly lady here. Doctor, I had reversed, I wanted to attend your session, but I could not attend. But you know, I have reversed my diabetes. I said, what? What did you do? She said 3 things, you know, out of which it's there here. She said, I did exercise. Huh? Why did you do exercise? What kind of exercise? No, I lifted weights, she said. She did like this. She's a very elderly, lady. She said, I did exercise. So there is some weight you have to lift. No going to gym. Just go to the local market and bring 2 kgs of vegetables holding in hand. Refined seed oils and refined carbohydrates, anything refined. Avoid it like poison. Anything refined, anything, they say if it is refined, if that word refined is there, avoid it. Of course, we have talked about good fats, ghee, coconut oil, butter. Have nicely. Don't be afraid of ghee and butter. You should be afraid of ghee and butter if you are consuming very high quantity of carbohydrates. There are a lot of people in this campus who are above 70. And it has been a kindness of grace of the Sadguru that I was able to interact with them, understand them, take a session for them, treat some of them in the first year of my work here. We should understand why they are living so long. When I ask average doctor, the doctor says that, the doctor says that I only live for 65 years. What are you worried about your long life? 100 years is the dictum that yoga gives us. Keep it simple. Don't complicate it by numbers like this. 10, 14, 11, 13, 12, 12, 13, 11, 14, 10, 16, 8. These are all intermittent fasting numbers. Even fasting also is intermittent. Everybody will pick up, simple. Get back to normal Ekadashi. It will do good. 36 hours of fasting will do very good for you. So with this I will end. Thank you very much. I would ask, welcome if you want to have any questions, please.
Thank you, Dr. Devji. Your talks are always leave a very lasting impression on us, making us mindful and sometimes even guilty. And the next session with lunch being next on the agenda, I think the less said, the better for everyone.
So you always call me pre-lunch,
Incidentally, I don't know how that happens, sir. I request Dr. Anandji to please hand over a token of our appreciation to Dr. Patil. Thank you. We will break for lunch and we'll resume the next session at 2 p.m. Thank you.